Psittacosis, commonly known as parrot fever, is a rare infectious disease caused by the bacterium Chlamydia psittaci. While the name suggests a connection to parrots, the disease can be transmitted from a variety of birds, including parrots, pigeons, sparrows, ducks, and poultry. Here are some key points about psittacosis. The bacterium Chlamydia psittaci is typically found in the respiratory secretions and feces of infected birds. Humans usually contract psittacosis through inhalation of airborne particles contaminated with these secretions. Direct contact with infected birds or their droppings can also transmit the disease. The symptoms of psittacosis can vary widely, ranging from mild flu-like symptoms to severe pneumonia. Common symptoms include fever, chills, headache, muscle aches, dry cough, difficulty breathing, and chest pain. In some cases, the infection can lead to severe respiratory illness requiring hospitalization. Diagnosing psittacosis can be challenging because its symptoms can resemble those of other respiratory infections. Doctors typically rely on a combination of clinical symptoms, laboratory tests, and a patient's history of exposure to birds to make a diagnosis. Blood tests, chest X-rays, and culture of respiratory secretions may be used to confirm the presence of Chlamydia psittaci. Psittacosis is usually treated with antibiotics, such as doxycycline or azithromycin. Early treatment is essential to prevent complications and reduce the severity of symptoms. Most patients recover fully with appropriate antibiotic therapy, although recovery may take several weeks in severe cases. Preventing psittacosis involves minimizing exposure to infected birds and their droppings. People who work with birds, such as pet owners, veterinarians, and poultry farmers, should take precautions such as wearing protective clothing and masks, practicing good hand hygiene, and maintaining clean living and working environments for birds. While psittacosis is rare in humans, outbreaks have been reported, particularly among people who work closely with birds or live in close proximity to large bird populations. Public health authorities may investigate and implement control measures to prevent the spread of the disease during outbreaks. Overall, while psittacosis is relatively uncommon, it is important for people who work with birds or have close contact with them to be aware of the risks and take appropriate precautions to prevent infection.